Now, chronic kidney disease could actually bring up a whole lot of complications to the patient. So if you are saying you want to monitor it based on clinical manifestation, I'm just trying to say, if a patient with chronic kidney disease is having a whole lot of fluid buildup in the body, that's edema, I'm picking edema to monitor it as a condition. If there's pain, I'm picking pain to monitor it as a to manage it as a condition. Do you understand? So sometimes chronic kidney disease is something that you can't really reverse. Okay, so you just want to manage these presentations or manifestations so that you can be able to improve the quality of life for the time being. All right, before you guys go into renal transplant or even before the patient dies. Do you understand? So let's try to link up each of the manifestations and how you can be able to manage it. So managing chronic kidney disease based on clinical manifestation, it means you are trying to tailor the treatment to the specific issues that the patient is having as they are having the chronic kidney disease. Do you understand? So you are tailoring it towards the specific symptoms, complications. Okay. So for hypertension, just make sure that you maintain hypertension, that's blood pressure, should be less than 130/80. So you can make this happen by using all those angiotensin converting enzyme inhibitors, calcium channel blockers or diuretics. Okay, lifestyle changes. The person should be taking low sodium containing foods. Okay, weight control, they should be exercising. Could not be too much exercise, but at least, okay, good quality exercise. Proteinuria, the person is losing proteins in urine, okay, and this is not nice. So you are trying to use drugs like angiotensin converting enzyme inhibitors, sodium glucose cotransporter inhibitors, then dietary protein moderation. Okay, the amount of proteins they used to take before will not be the same thing as what they are taking now. Okay, then anemia. The kidney produces a protein known as erythropoietin, which steps up the process of red blood cell production. That's what erythropoiesis, So, of course, they are lacking erythropoietin because, the production is reducing. So you can use erythropoiesis-stimulating agents, iron supplementation. Then you keep monitoring hemoglobin and ferritin levels. Okay. Then mineral and bone disorders, okay, low calciums, low phosphates, high parathyroidism, So you want to use phosphate binders, vitamin D analogs, dietary phosphorus restriction. Okay. Then fluid overload and edema. So they are having issues with fluid buildup in the body. So their legs are becoming swollen, their hands are becoming swollen, the face is becoming swollen. So you can use drugs that will help to put out this fluid from the body. Look, diuretics, they should restrict how they are taking sodiums because you have issues with putting out sodium and water from the body. Okay, so dialysis in advanced stages. Then electrolyte imbalance, they are having high potassium. Okay, so dietary control of potassium binders, emergency treatment with insulin, glucose, calcium gluconate if severe. Then they're also having issues of acids build back in the body. Okay, so if acid is built back in the body, you give what? Base, so that it will neutralize the acid. So that's where sodium bicarbonate actually comes in. Okay, then heart issues, where you are using drugs that will prevent all those heart complications. Uremic symptoms, okay, renal replacement, or you just calculate symptom by symptom. So psychological issues, that one, they will guide you on the type of food to be eating. Mental health support for depression and anxiety, social work for financial and family support. So this is what we have here for the management of chronic kidney disease, and this is based on the signs and symptoms that are actually coming up.